Thanks for joining me, Jasmine. As I said, this is just an experimental thing that I'm doing at the moment because obviously we're all stuck at home, and we're all trying to sort of keep visible with our businesses and stuff. And I just thought this might be worth having a go. So, just for anyone watching, just tell them who you are and what you're about.
Brilliant. Well, hi everyone. My name is Jasmine and I run JOsteopathy. So basically, I am a osteopath, not just for people, but for dogs and horses as well.
When I first met you, I'd never actually heard of someone doing both animals and humans. How did you get into that? What was the driving force behind that?
Yeah, well, first of all, I didn't even really know animal osteopathy existed anyway until I was at uni. With the people osteopathy side, I was always interested in like healthcare, like being a doctor or a nurse or something like that.
Yeah.
But when I was in sixth forms, like college years, my mum injured her back when she was at work.
Yeah.
And she went to the doctors, but it was sort of the normal, like prescribe painkillers and see how it goes. And it wasn't really helping her. So she then went to an osteopath. And I was like 16 or 17 thinking, what the hell is an osteopath? Is it just to do with bones or something? I don't know. So I thought, okay, we'll see. And I sort of went with her to the appointment. And I was actually really fascinated by their approach to managing my mum's back pain.
Yeah.
And I found out with osteopathy that they don't just take into account your like complaints, so your current back pain, but they also look into account your lifestyle factors, any previous injuries or anything that could be contributing to your pain.
Right.
And it was almost like you was being a detective, figuring out what could be causing it, because it wasn't always just things like the back. Like my mum's ankle had issues as well, and he was explaining how that's contributing to her back. And I actually really liked that approach, and I liked the fact it was a hands-on treatment rather than using medicine. So I thought, actually, I'll give that a go instead of the sort of normal medical route. I'll try osteopathy. So then straight after school, I went to uni. And then when I was in second year of uni, we had a guest speaker. And the guest speaker was a man called Stuart McGregor. And he is an animal osteopath. And he was one of the first sort of animal osteopaths to exist. And I was just like, wow, that's amazing. Because I've been brought up with animals my whole life. Me and my mum have raised so many animals. We've rescued animals, rehabbed them, stuff like that. So I've always had that inside of me to help animals as well.
Yeah.
And when I found out you can treat like dogs and horses and stuff, I thought when I graduate from university, I'm definitely going to learn those things as well. So that's where the animal side came in.
Brilliant. So how long does it take to get to where you are now? I mean, how long's the training? What was involved in your sort of experience?
Yeah, so the human like osteopathy course is a full 4-year full-time course.
Wow.
You're pretty much like 9 till 5 Monday to Friday, whether that is like lectures or hands-on techniques. So I did a lot of practical work, and in the final 2 years you actually do over 1,000 hours. It was either 1,200 or 1,500. I can't remember right now. But it was a lot of hours with the general public and treating them in private clinics. And we also worked in NHS clinics as well. So it was very intense, and we had to do a 20,000 word dissertation, which wasn't fun, as well as loads of exams and other essays, but somehow made it through. Don't know how, but a lot of hard work. Yeah. And then with the animal course, there was 2 courses I did. So they're both sort of postgraduate certificate and then the diploma. And then they're long distance courses. So you're there 1 weekend a month. And then you have to do a lot of coursework in between then. And you do case studies where you live. So you find dog patients, horse patients, and do lots of essays and exams that way as well. And it was about like 4 to 6 months contact time, like once per month, and then you had another few months of assessments and things, and then the diploma was a bit longer than that, so it took about 9 months to do all of that. Wow. As well. So it was so from like leaving school to Now it probably took me about 6 years in total to get to where I am now.
Wow, that's longer than like some master's degrees, isn't it? That's huge.
Yeah, I mean, the osteopathy course is like an integrated master's. So your
Right.
final year is like your master's level year, if you
Yeah, I can
like.
imagine.
So
So
it's
you've been,
intense, but it's done now, so that's good.
yeah. Oh, well, yeah. I mean, obviously, you've been, so your last couple of years whilst you were still studying was actually practicing what you're doing anyway. So you've been working with people ever, all that through that period.
Yeah, exactly. So I qualified in 2016, but I've been hands-on with like real life clients that are in pain since 2014, it'd be
Wow.
third year. So yeah, it has been coming up to 7 years now. But that's really scary.
Well, that's amazing that I mean,
Yeah.
obviously you know your stuff, and I mean, have you had any sort of barriers or any sort of, things that have been difficult throughout that period of time?
Oh, definitely. Yeah, it's quite frustrating, really. When I've first graduated, even like from last year, I have had a few clients before I've even treated them, before I've even taken them into the treatment room, question if I'm actually a real osteopath because they thought I looked too young to
Right.
be an osteopath. And then they say, "Are you the receptionist or
Oh,
something?" I'm
no.
like, "No, I'm the osteopath." And it's like, it's really frustrating because,
Yeah.
I've done my degree. I even got a first class honours, which is like the best you can get.
Well done.
I've worked damn hard for this. And
Yeah.
then you're assuming that I'm not going to be competent enough. And that is hard. And it is hard to convert those people.
Mm.
And sometimes I've had 2 instances where they've actually wanted me to prove I was a member of the General
Really?
Osteopathic Council. So I had to show them my certificate. It's, yeah,
That's just crazy. It's
again,
sad.
before I treated them.
Yeah, it's sad that you've had to sort of go through that, but clearly, I mean, you've been studying and working in this for, as you say, for close to 7 years. It's this is your bread and butter. You know what you're talking about. It's just unfortunate that some people don't see it that way. So yeah,
Yeah,
sorry to hear that.
exactly. No, it's all right. I mean, what I've sort of learnt is I need to focus on the people that I am helping, because I've
Mm.
helped a lot of people and I've seen, they're so grateful for what I've done and what I've done to help them. So I'm trying to focus on them rather than focusing on those people, because thankfully those sort of people are in the minority.
Yeah, yeah. I think people
So,
can.
yeah.
Well, people will see you, what you do, and they see the value, and obviously what other people say about you. I mean, I've seen your Google reviews, and people speak very highly of you. So
Oh,
I think
thanks.
I think that, well, it's not me. I'm
Yeah,
just
no.
reading what's already
Yeah.
out there. So you obviously know what you're talking about. Otherwise, people wouldn't be saying it. So and I am obviously a little bit biased because obviously you did see my dog, my Gollum, and
Yeah,
yeah,
bless him. So cute.
so obviously at the moment, I mean, you are hands-on, and how do you operate? Do you work from a clinic, or do you sort of home visits? What's your area of work?
Yeah, so I currently work as an associate osteopath in 3 different clinics based in Dartford, Gravesend, and Orpington. And then I also do home visits for people around those sort of areas, sort of going as far down as Medway and then South East London, sort of that area. And I also provide home visits for dogs and yard visits for horses as well, around that sort of area as well. So
Wow,
quite a few different bits that I do normally anyway.
that's great. I mean, horses. I mean, obviously, sort of southeast Kent. There's probably quite a lot of. Is there any areas that you particularly work at?
Yeah, it's, to be fair, all quite sort of local. I mean, I'm from Dartford area and there is a lot of horses and yards and stuff. So thankfully, things are on my doorstep there. So that all works out quite nicely.
Brilliant. I know we've spoken before. You said that you sort of sometimes volunteer at places. Just tell me a little, tell us about that.
Yeah. So currently I volunteer at Foal Farm, which is based in Biggin Hill, and they have a lot of rescue dogs. So we've liaised with the vet, because to be an animal osteopath, to be able to treat animals, you need to get vet consent. So I've liaised with their vet, and they're happy for me to volunteer and actually provide osteopathy treatment to the dogs that need it there.
Brilliant.
Which is really nice, because there's a lot of dogs that, you know, are a bit more older, or they have come in with certain health conditions where they can really benefit from having that hands-on treatment.
That's great. And you obviously that you do that, is that voluntary? You don't get paid for that? Or
Yeah, that's voluntary.
Wow.
Yeah, just to help the dogs. I love dogs, so
That's brilliant. It's so good that you're doing stuff like that. So I guess the big thing at the moment is the lockdown, and you know, how that's affecting all of our businesses. So how are you dealing with it? Because obviously, you know, like me, it's normally involves being in the company of other people. So what's
I mean, it has shown its difficulties, because obviously I want to, you know, osteopathy is like hands-on type of treatment, and at this point in time I can't do that. So what I'm doing is I'm contacting all my clients that I would have seen, that I was booked in, and I'm phoning them up to check how they're doing, not just about the aches and pains, but just to check that everybody's safe and well, that their families and stuff. So I just want to make sure everyone's okay, and to show that I do generally care about everyone. So yeah, so I'm doing that, and then I'm finding out how they're doing in terms of their aches and pains as well, if they're getting any new symptoms or if it's feeling better. And I'm providing them with relevant advice, exercises they can do at home as well. And I'm doing follow-up calls every 2 weeks or sooner, depending on their preference as well.
Fantastic.
So yeah, I'm trying to keep in contact with everybody as much as I can. And also, whilst I'm sort of behind the scenes at the moment, working a bit more on the website, social media, just to keep people engaged and things, you know, just to help people out where I can.
Brilliant. How have they responded to that when you've called them up? And
you know what, it's actually been really nice. Like, some clients have been really taken aback by me calling them, but for me it was like a natural thing to do that. But they was really surprised that I went to the effort to do that, and it was really quite rewarding actually to hear how grateful they are, and to be able to reassure them to know actually they can talk to me if at any point they do need any help or advice.
that's amazing. So you know, it's great to hear that you're still in contact with your clients, and they're appreciating it. And you seem to go the extra mile all the time.
I don't know about the extra mile. It's just natural instinct. I think it's the empathy part of me with being that sort of caring role, I suppose. But I don't mind it. It's not like hard work in that sense. I enjoy it, if you get me. It's hard to explain. It's
I think anybody that works for themselves, everyone has a reason for starting what they do, and you've obviously explained yours. And I think you've got to love it to be able to sort of run your own business, if you like.
Oh, definitely, because it isn't easy running your own business.
No.
So but it's definitely worth it, seeing the satisfaction that patients and that gets. So it's good.
Yeah, that's fantastic. So obviously you can't do a lot of the manipulation work that an osteopath would normally do. So how are you kind of explaining things to them? Are you know, sending them information, or are you just explaining things over the phone to them?
Yeah, so what I do initially is I call them, so phone chat first of all. We'll talk through things to make sure they understand. And then I will send them an email with instructions and images as well. And if they feel uncomfortable still, then I'll go through video chat and go through it with them that way, because then I can watch them do the stretch as well, and then give them little pointers.
Oh, fantastic. So you're an avid Zoom user now?
Yeah, getting used to it. It's not too bad actually, is it?
No.
So yeah, it works out well.
That's brilliant. So for me, obviously very similar. It's normally a hands-on kind of job, but I'm spending a lot of time sitting at my desk. A lot of people working from home at the moment. Do you have any sort of, really good tips that anybody could sort of take away from this, and so that just so that we don't get back? I mean, I've had a bad back because of just
Oh,
working
bless you.
away. So what
Yeah.
what could you give us?
Well, you need to keep moving, guys. I know we're stuck at home, but we need to get off our chairs and keep moving. Even if it's walking around every 30 to 40 minutes just to get yourself a cup of tea or a drink of water. You don't want to be stuck on your chair for hours. If you can do some stretching as well, I mean, I can put some links up if you like, Graham. I've got a few that you can even do using your chair. So say if you're doing loads of Zoom video meetings with all your work colleagues for hours and hours, maybe you can all do a group stretching session every hour or so using some of these stretches. Because otherwise, if you're stuck there for ages, the muscles are going to start to get tight and you're going to feel quite stiff.
So obviously really grateful for all the tips and about your story and what you're doing with your clients now. It's great to hear that you're being active. So when this lockdown finally ends, well, hopefully sooner rather than later, what's the plans for you? What's next for Jasmine?
Yeah, well, I'm going to contact all my clients again and gradually get back into sort of normal clinic routine with them first of all, and also any new clients just book them in as per usual. Also, one of my long-term aims is raising awareness of animal osteopathy, because it's something that a lot of people haven't really heard of. So I know, unfortunately, one of the events I was going to do has been postponed because of this lockdown, but sort of going to fairs and things to try to raise awareness that way, seeing sort of general public that might not have considered it in the first place, and just generally talking and sort of cross-promoting with other businesses to help them understand how animal osteopathy can benefit as well.
That's brilliant. So if anybody was watching this, how could anybody help you at this time?
It's difficult, really. I mean, I think really, as I say, I want to raise awareness of things. So if you know anybody in any sort of animal related business or any healthcare sort of related businesses or wellness things, then maybe if you could pass on their details to me, or vice versa, if you pass on my details to them, it would be really great for me to be able to get in contact with them. I love getting to know people, and if I can help them and then return the favour, help each other out, then that's great, especially in this time where all businesses are struggling at the moment and we need to help each other as much as we can.
Definitely, it's good advice, and I'm more than happy to sort of put you in contact with people. I know you're getting into the sort of networking side of things as well, which is great. I mean, that's how we sort of got to know each other, through the networking. So just before we sort of wrap up, is there anything else you'd like to say?
Yeah, well, I'd just like to thank you for your time and for interviewing me. No, I really appreciate it. It's nice to sort of get, like my name out there still, I still exist, that type of thing. And also for your help, like the last week or so as well, because, we've been sort of chatting as well, and I was having problems with trying to figure out how to do this sort of screen because of the way that I live, the lighting isn't very good and things. So you really helped me out with some pointers. And yeah, no, I really appreciate that. And also you've been helping me just little bits and bobs on the website as well. And it does make the whole world of difference. I really appreciate it right now. Thank you.
Well, thank you for saying. No, it's
Right.
I think where everyone is going online at the moment, a lot of people are kind of rushing into it and they're not actually thinking about necessarily little basic stuff. It comes natural to me as a photographer, and so I know about lighting and stuff. So I'm more than happy to sort of share those bits and pieces with you. And it's great to see that you're still smiling. I know you've had a bit of a very stressful time recently. So it's good to see that, we're keeping going and we're supporting each other through this difficult time. So thank you for saying that. And thank you for joining me today on this little chat. So it's been really good. I've really enjoyed doing this. I think
Yeah, I really
it
enjoyed
might
as
it might turn
well.
into something. We might get a few more people on and see how it goes.
That sounds like a perfect idea.
Brilliant.
Great.
All right, take care,
Yeah.
Jasmine. Thanks ever so
You
much.
too.
And
Stay safe. Everyone stay safe
definitely
and
stay
well.
safe, everybody. And
Yeah.
thanks for watching. So I hope you enjoyed it. I'm going to be doing a few more of these, and maybe it'll turn into something, maybe not. But at the moment, it's all about networking, helping each other out, and staying connected. So that's all I'm doing this for. So take care, everybody. See ya.
Bye.